this is Jacob Goss, and he is a master's in athletic training student in our program. So he's going to talk about the short and long-term effects on specialization in youth baseball players. I'm going to turn it over to Jacob and let him go ahead and go for it.
All right. Is ready to go?
Yes, sir.
All right. So, like Dr. Clark said, my name is Jacob, and this is my symposium presentation on the short and long-term effects that sports specialization has on the youth baseball player. So, to start off, we asked, what is sports specialization? Well, sports specialization is year-round participation in a single sport with intense, high-volume training. And there's a problem because there's a rise in participation among youth sports, and that short-term effects can include upper extremity or overuse and fatigue of muscles, and then longer-term effects are not easily understood among the youth baseball player. So this leads to our focused clinical question on what are the short and long-term effects that sports specialization has on the youth baseball player. So for my CAD, I used my search strategy included the PICO method. I used the patient-client group I found with youth baseball players ages 8 to 19 years old. My intervention, I used sports specialization and youth baseball. My comparison, I did high school or club sport. And then my outcome is short or long-term injury. So my inclusion and exclusion criteria, made up of patients aged 8 from 19 years old. They specialize in baseball year-round, so they did not stop. They included patients who had upper extremity injury, and they also included these injuries either resulted in surgery or rehabilitation. And it also mentioned prevention strategies and also the parent and coach perception on sports specialization as a whole. And then my exclusion criteria included patients under the ages of 7 and over the age of 19 and lower body injury. So for my evidence quality assessment, I found 6 articles that I chose to talk about in this PowerPoint. And these 6 PowerPoints, I found the validity by determining by the physiotherapy evidence database, or PEDRO for short, and the stroke scale. And I also used the Center of Evidence-Based Medicine to utilize for the evaluation of the studies. My results of surge, like I said, retrieved 6 studies. That all the studies met inclusion and exclusion criteria, and I'm going to categorize it in the next couple of slides in tables 2, 3, and 4. So table 2, when I talk about compare the short and long-term effects that sports specialization has on youth baseball players, and includes they include the effects that it had on their throwing arm function. Table 3 talks about the perception that both coaches and parents have in both high school and club sports. And then Table 4 looked at prevention programs that worked on limiting the injuries that may be caused by sports specialization. So this is my 2 studies talking about the short and long-term effects. Post and colleagues, they talked about in their article that they looked at 12 Southern California Little League organizations. They included between the ages of 7 and 12 years old, and the mean age was around 9.5 years old. The methods was anonymous online questionnaire, and it was parent assisted, obviously, because they're minors. And it included 3 sections, which was participant demographic, baseball participation, and youth throwing score. And the youth throwing scores, they found if they're high, moderate, or low, and the results of their studies found that the highly specialized groups reported worse scores compared to other groups that had low or moderate. And then highly specialized participants reported play in showcases during the off-season, which is just extra leagues outside their main season. And then Koshi and colleagues, they talked about collegiate league. And they talked about Division 2, 3, and NAIA. And they separated 2 things: the specialization level, which is high, moderate, and low. They did it by the studies were back. They had to be done before the patient reached 13 years old. And the dependent variable was the functional arm scale for throwers, which for short is fast, and then the Carolyn Joe Orthopedic Clinic, or the KJOT scale. So the highly specialized group found to have worse ejected throwing arm function through the fast scale. And they've been shown by the collegiate level these athletes were 5 times more likely to report a history of shoulder injury and 3 times more likely to present a history of elbow injury. And this result found in the long term for the collegiate level. So Table 3 talks about coach and parent perception. So DeSanti and colleagues, they focus more on the Michigan High School Athletic Association, and they included both parents and coaches, and players. It was a 25-item survey, and to a Likert scale, between 1 would strongly disagree and 4 would strongly agree with what sports specialization was at that level. The results found that club coaches perceive sports specialization as a positive adaptive practice, while it was also found that different sexes played a role in sports specialization. It was found that males specialized most in high school in club sports. The sports they found mostly were basketball, soccer, and volleyball, which they also found that school and community did not influence their the youth decision making. And then Hernandez and colleagues, they looked at another high school, but they did more vague around the United States, which they may have been 1,909 participants, 993 children, or it's split 50-50 between children and parents. And questionnaire divided into 4 sections: demographics, specialization status, attitudes and beliefs, and then injury history in the previous 12 months prior to the survey. And then it found that 39.1% of children self-classified themselves as highly specialized, while 19.9% of parents said their child's specialization level was high. And then the highest number of specializations were in baseball, and in basketball, volleyball, and soccer had the highest response rates between both male and female. And then parents were more concerned about the injury risks throughout all the sports, and then children are more likely to believe that specialization will help them get a collegiate scholarship. Then my last table, talk about prevention programs. Sakata and colleagues, they talk about how stretching interventions, dynamic mobility and balance training can help prevent injuries from happening in the long run. Their results found that incidents of shoulder and elbow injuries were significantly lower in their intervention group compared to the placebo group they had that didn't do exercises. And then 1.7 per 1,000 athletic exposures were found in intervention, 3.1 per 1,000 athletic exposures were found in the control. And the program was found to improve pitch speed and performance, and the program also improved the range of motion. And that range of motion improvement was found in shoulder abduction and internal rotation of the shoulder. And then Rennigan and colleagues, they talked about youth baseball in general and about education mainly. And what they did was a 22-question survey about the demographic, throwing guidelines, the pitching history, and overhead throwing risks and pitching habits. And it was found that 83% of the coaches and players who've done this review were unaware of the existence of the safe pitching guidelines. And then the throwing pain and the athletes presented greater than 6 months out. And then 52% of parents recalled their child having arm pain from pitching, and 26% of patients had to miss a game due to injury, while 27% had to seek medical evaluation, which goes back to the surgery. And overuse of curveballs were found common, especially within patients 13 years older, that found them to be more susceptible to that injury. So my clinical bottom line throughout all this data is that sports specialization at a young age can create the risk of injury, and them injuries can be either shoulder or elbow, and they can also range from mild arm pain to season-ending surgery. And then long-term issues could affect an athlete at a collegiate or professional level. So future research on this topic can also help out, because it can determine how much parent-child relationships is incorporated with this decision-making. And then the youth athlete's mental health can be looked at to play a huge part. And then sports specialization can be used in different sports and populations for this topic alone. For example, youth females in softball. And then longitudinal studies, I would like to see more, because most of my studies, I would like to see more of a year feedback, and then ensures a more accurate reading, if so. And my references. I'd like to thank the symposium for accepting my presentation. I thank Dr. Chris Clark and Jennifer Savage, and also my colleagues.
Questions for our speaker?
What prompted your inquiry into this specific subject? What made you want to research this?
So what made me want to do this PowerPoint and research was back in high school, I was one of the kids who specialized in one sport. And I never had major injury problems, but I've always had arm pain and all that. So it kind of made me delve deep into the subject, and I've always thought, I was like, couldn't be the only one that suffered from it or felt the same way.
Thank you.
All right, let's thank our speaker again.